Friends, one of my patients asked me, Sir, can I get my blood test done by Thyrocare Institute? I said yes, by all means. These are all good institutions which do good blood test. There is no question about it. There are many such institutes like Metropolis, Thyrocare, Lal Pathlabs and so on. But the question arises, who has advised you to get this test done? He said, no, I just read it in the newspaper that it is very cheap. It is given at discounted rates. So can I get my whole body test done? I said, my advice is that you must first go to your doctor if you have any complaint, or if you are above the age of 40 years and if you follow the principles of regular health checkup, then you first go to your doctor, get yourself checked up, and then he will recommend you which blood test to be done. Because a relevant blood test has to be done which will help the doctor to decide what health problems you have got and whether you need any medical treatment or not. Just to get the blood test done because it is available free is not a good idea. Because one of my patients came with a blood test done by Thyrocare. It was more than 45 pages, and in those 45 pages more than 200 blood test reports were to be studied by a doctor. See, when you do a lot of blood tests, one should remember that there is a false positive and false negative blood test. And it is the doctor who will decide whether this test is useful to you or not useful to you. Just by doing lots of blood tests because it is available free or at discounted rates is not a good idea. Because your health is your right, but you must get a proper guidance both by a health experts, that may be your family doctor or your family consultant physician. Without their guidance, you should not go for any blood test, because laboratories give results but they don't give diagnosis. They don't know everything about you, and one has to correlate blood test with your clinical condition. These blood tests sometimes create healthy patients. They are healthy, but now they have a blood report which is abnormal. So they are labeled as a patient and they are being treated by various drugs which may be on long term, may not be useful but rather harmful. So my advice is that you must go to your doctor first, and whatever he recommends, that blood test only should be performed, which he can then analyze and then guide you whether you need any treatment or you are totally fit person and need no treatment. Thank you very much.